After you've experienced a heart attack, stroke, bypass surgery, or just need to reduce your cardiac risk factors, you'll be referred to a cardiac rehab center. Here to explain the program is registered nurse Michelle Bruny of Redlands Community Hospital.
It starts in the hospital when they've had an event. We start the process there, education, exercise. Then they go home, they follow up with an outpatient service such as we have here. Then, you know, the modifying the lifestyle changes, getting them, because what they were doing prior to this wasn't working, so now we have to introduce new methods and give them some new techniques and tools that they can take home and start working on. And then the exercise component, and then the follow-up component as far as the phase 3 or the community process of it, going out into the community and following these patients for many, many years, and making sure they're okay with their diet, checking their body fat, getting their waist measurements, setting goals, because it's a constant change. As the world that we live in, everything is full of change, and so, you know, you take that, and I continue to meet with those patients and follow them and track them to make sure that they're modifying their risk factors to keep them out of the hospital and maintain their health and wellness. We have some classes that are available. We send them to the classes depending on what their risk factors are. And then along the way, it's a constant. Every time they come in 3 times a week, we're asking them, you know, how are you doing with your diet? What's going on? Are you modifying this area? Are you, you know, we kind of give them homework assignments, and then we follow them and track them. I tell my patients it takes about 21 days to form a habit. So give me about a month, coming in 3 times a week, and let's see, you know, if we can make a habit of, you know, better lifestyle as far as healthier, eating healthier, exercising, kind of getting into a healthier mind frame than what they were before. It's what the patient puts into it. By the time they had their procedure done, their stent or their bypass surgery, then it's kind of up to them to put in the effort and the time. Of course, we have great medications on board now. And it's basically kind of up to the patient as far as doing their rehab. We definitely get them started. We have a phase 2 and a phase 3 program. The phase 3 meaning we follow them in the community after they finish the inpatient or the outpatient setting. But it's really kind of up to them to keep their progress and keep motivated and continue to do what they're supposed to do. But if they do that, they have pretty good success rates. Some of the ways that we can prevent a heart attack are knowing our numbers, such as your blood pressure, knowing what normal is, knowing what your numbers are, your cholesterol, knowing all your cholesterol numbers from the full lipid panel, maintaining a good healthy weight, obviously stop smoking. If you're diabetic, knowing what your diabetic numbers are, your blood sugars, your hemoglobin A1C, managing those numbers, eating right, exercising, and stress management, managing your stress and not being overwhelmed in life, and enjoy life. Enjoy your family and try to take good care of yourself, because there's only one of you, and you need to consider that you need to take care of yourself. I tell my patients, your doctor has 500 patients, there's only one of you. You need to know your numbers and be responsible for your numbers, and the medications that you take, know what you're taking, what they're for.